Thank you for allowing us to present this informational presentation on the Enemies product line. We value our working relationship with you and your staff. Sometimes questions can lead to more than just answers. Some answers change lives. Why are we here today? As we visit with hospitals across the country, we hear that bowel care management both on the inpatient side and outpatient side continues to remain a challenge for many patients and providers. The various prescribing choices, limited education, and research in this area of care can provide challenges in assisting patients in establishing a consistent bowel care protocol. However, if a patient is not on an established bowel care program, research has shown that patient is at a higher risk of discomfort, painful bowel movements, and fecal incontinence. 46% of patients requiring long-term care are experiencing fecal incontinence, thus leading to nosocomial infections, bacteremia, infection-associated dermatitis, IAD, skin breakdown, and pressure ulcers. This remains a growing concern of care for providers across the country. The facts are stacked against spinal cord injury patients in long care settings. Incontinence is now the second leading cause of admission. 50% of elderly patients are readmitted for incontinence issues. This group is 22 times higher risk to acquire a pressure ulcer. That number jumps to 37.5% if the patient is mobility impaired. Is this your patient base? Are your patients at risk? Are you doing enough to address bowel care? How can you, as their provider, assist them? By making bowel care a focus. Establishing a regimented bowel care program has shown to decrease episodes of fecal incontinence by 35%, with an added bonus of improved constipation and incidence of urinary tract infections. Why does an improved bowel care program matter to your patients and providers? With these staggering numbers and 95% of spinal cord injury patients requiring a therapeutic interventional product for bowel care evacuation assistance, and being the #1 complication of SCI patients, we are here to share with you the therapeutic profile of the Enemies product line with a side-by-side product comparison. The Enemies formulation of docusate sodium in a base of polyethylene glycol functions as a hyperosmotic laxative by drawing water into the bowel from surrounding body tissues. The docusate sodium acts as a softener by preparing the stool to readily mix with watery fluids. The increased mass of stool promotes a bowel evacuation by stimulating nerve endings in the bowel lining and initiating peristalsis. Not only does it soften and loosen the stool, but it initiates a normal stimulus. Enemies does not contain the ingredient found in bisacodyl products known to cause irritation, making the Enemies formulation non-irritating. For over 10 years and 22 million dosing units, Enemies has provided a natural, replicated bowel movement for thousands of patients. The Enemies Plus formulation contains 20 milligrams of benzocaine, assisting in the anesthetization of the rectum and lower bowel. The formulation was developed for neurogenic bowel patients who experience painful bowel movements or autonomic dysreflexia. Patients will be pleased to know that Enemies works extremely fast. 84% of patients report an evacuation in 1 to 20 minutes, reduced episodes of incontinence, and no discharge, which has a direct correlation in maintaining healthy skin integrity. Arthur, who is a wonderful man who experienced a C6 spinal injury, wanted to share with us how his life has changed after being introduced to Enemies, calling Enemies a true blessing. We have received countless letters from patients all over the country reporting faster bowel care times, increased confidence that they won't have an accident while away from their home, improved skin condition, and improved quality of life. Some have even referred to Enemies as the magic wand. These stories touch our hearts. For years, spinal cord injury patients and patients requiring long-term care have been prescribed bisacodyl suppositories for bowel care. In a product comparison, 42% of bisacodyl users experienced at least one episode of incontinence a week, with that number dropping to only 3% in Enemies users. Bisacodyl leaves the mucosal lining in a state of colitis for up to 24 hours after insertion. This reaction in the bowel happens 30 minutes after insertion. We ask you to consider the negative effects of long-term use when using bisacodyl as an active ingredient. Are your patients using bisacodyl every 24 hours? What are the risks to your patient's bowel when prescribing this product to be used long-term? Enemies has been shown to work twice as fast as a bisacodyl product, leading to a time saving of an average of 228 hours per year that a patient or provider will spend on bowel care. Nurses around the country report they spend 52.5 minutes per day with a patient that is incontinent, leading to a cost per patient of $2,253. The cone enema and large volume enemas are marketed heavily by large companies as the most reliable and easy to use. Why use this product as a long-term option when there is a more effective product, Enemies? Large volumes of any liquid in the bowel can possibly stretch the bowel when used long-term. Is this risk a risk your patient is willing to take when educated about the possible effects of using a cone or large volume enema? Please find a comprehensive comparison of prescribing products available today. How do your choices stack up? We would like to take a moment to recap the benefits for both patients and providers when prescribing Enemies as the bowel care choice. Patients can count on the Enemies product line to provide results in 2 to 15 minutes, easy rectal usage, no discharge or afterburn, safe, effective, and non-irritating formula. Healthcare providers can count on Enemies to assist in reduced nursing intervention for bowel care labor cost savings and improved incontinence rates, leading to a reduction in missed rehabilitation time and savings on soft cost items such as pads, gowns, and sheets due to episodes of incontinence. Please take a moment to view our Medicaid-approved states. We would sincerely like to thank you for your time today and truly value your dedication and interest in improving bowel care options for your patients. Our national representatives are available to answer any questions you may have about the product line or content presented here today. Please look to Enemies as your resource in the bowel care area. Thank you.